Hello and good evening. I'm Cheryl D'Souza and you're watching Goa 365. Our headlines for the day. BJP State Executive demands sacking of Finance Minister Dayanand Narvekar. Newborn baby screening program launched. IIT Alumni Association felicitates students who cleared the IIT entrance test. St. Anthony the Padua feast celebrated at Seoli. Those were our headlines. Now for the news in detail. The state executive meeting of the Bharatiya Janata Party passed a political resolution demanding the sacking of the Finance Minister Dayanand Narvekar from the state cabinet for being charge-sheeted for forgery in the ticket scam.
भारतीय जनता पक्ष ह्या रेझोल्युशनाक डिमांड करता की अशे तरेचो जो काही मिनिस्टर जो आसा फायनान्स मिनिस्टर आसा राज्याचो जो चार्जशीट जाल्लो आसा ताका बेगिना बेगीन ताणें राजीनामा दिवचो जाल्यार मुख्यमंत्र्यान ताका काडून उडयचो ही आनी गोंयची खंय तरी अशी इज्जत दवरची.
Briefing media persons, the BJP President Shripad Naik expressed shock at the statement made by the Chief Minister Digambar Kamath for backing Mr. Narvekar.
ह्या सरकाराचे फायनान्स मिनिस्टर बाब दयानंद नार्वेकर हाजेर तिकीट प्रकरण जे आशिल्लें ताचे चार्जीस आज फ्रेम जाल्ले आसात आनी हें सगळें आसतना मुख्यमंत्र्याचे ह्या संदर्भात जे हें आसा तें आश्चर्यजनक आसा की आनी आश्चर्य आनी धक्कादायक आसा कारण एक राज्याचो मुख्यमंत्री जे कितें चार्जीस कोर्टान फ्रेम केल्ले आसात ताजो सरकाराशी कांय संबंद ना म्हणटा पूण त्या मनशांचे तरी आसा वो अर्थमंत्री तुमचो अर्थमंत्री ह्या देशाचो ह्या राज्याचो अर्थमंत्री खंय तरी फसवणुकीचे आरोप ताचेर कोर्ट करता आनी मुख्यमंत्री ताजो आपल्याक कांय संबंद ना म्हणटा हें खरोखर दुर्दैव ह्या गोंयचें दुर्दैव अशें दिसता म्हाका.
The BJP also passed a resolution opposing offshore casinos in the state and demanded to bring an amendment in this direction.
दुसरो आमचो डिमांड आहा की सगळे कॅजिनोज जे आसात त्यांचे लायसन सपोज तांकां दिल्लें आसा ते लायसन कॅन्सल करची आनी खंय तरी अमेंडमेंट करपाक एंटी गॅम्बलिंग एक्ट हाडचो आनी सगळ्यो कॅजिनोची परमिशन रद्द करची.
Mr. Naik also gave reasons as to why they were opposing offshore casinos in Goa.
आमच्या म्हायती प्रमाणे जे कॅजिनो आयिल्ले आसात ते ऑफशोराचेर एक दीस टिकपाचे ना लोकांचे म्हणून ताणें तें फक्त ऑफशोराचें नांव घेवन ते हांगाच इनलँड हितूंकच तांची चाल आसा आनी म्हणून आमचो विरोध आसा.
The BJP also demanded an inquiry into the fraudulent allotment of lands by the Goa Industrial Development Corporation to the SEZs in the state.
SEZाच्यो ज्यो कांय जमनी दिल्ल्यो ह्यो जमनी ज्यो आसात ह्यो जमनी ह्या एक वेगळे तरेचीन ताच्यान डिलींग जाल्लें आसा खूब जाणांनी ह्या बाबतींत करप्शन केल्लें आसा आनी हाजी इन्क्वायरी करची आनी जे फ्रॉडुलंट अलॉटमेंट जाल्यात आनी ह्या संदर्भात जे कितें आसा ते खंय तरी हें बंद करचें आनी जमनी सगळ्यो परत घेवच्यो.
The BJP also asked the government to consider the genuine demands of the Goa Government Employees Association so that the pen down, tool down strike could be called off.
आनी जे राज्यांक जो काही एक सरकारी कर्मचाऱ्यांचो खंय तरी पेन डावन स्ट्रायक चल्लो आसा तांच्यो डिमांड जे आहा तांचे डिमांड जे जेन्युइन तांचे डिमांड आसा ते गव्हर्मेंट एम्प्लॉयीचे जेन्युइन डिमांड हे सरकारान कन्सिडर करचे आनी हे जे काही एडमिनिस्ट्रेशनाक जी काही बाधा आयिल्ली आसा ती बाधा पयस करची.
Goa has become the first state in India for testing newborn babies for genetic and metabolic disorders. The Health Minister Vishwajit Rane launched the newborn baby screening program at the Goa Medical College on Saturday. Through this program, all newborn babies will be screened at all government hospitals in Goa.
This is, the screening is what we do.
The Goa Medical College and Hospital in partnership with the Neogen Labs using tandem mass spectrometry technology licensed from Perkin-Elmer Genetics USA will screen newborn babies. Speaking to media persons, Mr. Rane said that the state would spend around 2 crore rupees for this program and around 7,500 babies would be screened for genetic and metabolic disorders.
All the government setups, wherever the deliveries take place, and initial estimate is at around 1.8 to 2 crores. Per test it is around 2,000 rupees per child. But as our hospitals also increasing, new facilities we are slowly bringing about, delivery also tentatively, definitely in proportion will increase. So accordingly the cost will go up. But it's covered under our medical reimbursement of Mediclaim. It's covered under.
He said that they were also thinking of making this screening mandatory in all private hospitals in Goa.
This facility is an expensive test. We have introduced it because it will definitely help the common man and the poor people, because to detect problems if any in the child at an early stage, so they can accordingly take steps. We are also coming forward to see that how do you monitor this and what sort of management should be there for taking corrective steps. But in private hospitals, I don't think at this stage is required to be mandatory. First, let us do it in our government setup, and then subsequently we can think of making it mandatory in the private hospital. But that is in my mind. So we have to first introduce it here properly. Let us see how it goes, and then we will make it mandatory in other setups.
Speaking to Goa 365, Senior Manager of Neogen Labs, Nihal George, told us the benefits of conducting this test.
Typically when a baby is born, you really don't know if there's some underlying problem. A doctor, by looking at a baby, just doesn't know that, if it suffers from one of these metabolic disorders. Some of these manifest themselves in maybe a week, some in 6 months, maybe some 10 years later. So the biggest benefit about doing this test is that 24 hours after birth, it's a 100% accurate test, and you get to know if the baby suffers from any one of 50 disorders. And what you can do is that if you detect the disorder, you can start treatment and ensure completely normal development.
He also provided us more information about his company.
Right, we've actually partnered, our lab is set up in Bangalore, in Karnataka, and we've partnered with a company called Pediatrics in the US. Pediatrics is one of the pioneers of newborn screening. They've been doing it for the last 15 years or so in the US, and they've tested about 3 million babies till date, and they continue to do about 400,000 every year. So the data that they have and the accuracy of their test is phenomenal. So we've got a license from them to set up a lab in India. It's a technology license, and it's basically a technology transfer from the US to India, and we set up the lab with their help, and we only started commercial operations once we were approved and certified by them.
We'll spill into a commercial break. Stay with us.